In a busy businessman who's pulling a few weights in his lunch hour at work, or in someone who's undertaken some aggressive activity that he's not accustomed to, you can get breakdown of this tendon on either of the tendon, causing tennis elbow or golfer's elbow, or indeed they can both coexist together. These conditions are controversial in their management. The vast majority of them do improve with conservative treatment, with physiotherapy, with local ultrasound treatment, occasionally a steroid injection, or indeed an injection now these patients can be treated with platelet-rich plasma injections, which are when blood can be taken from the patient himself, and with a centrifuge, the clotting and healing factors of the patient's blood can be injected into that area where the tendon has frayed. However, more simple methods of treatment, such as physiotherapy, rest, changing the activity and avoiding the provoking activity, wearing a clasp or a brace over there, shockwave therapy. There are a number of conservative treatments of this which are extremely successful. I've mentioned the injections, which there's a place for, and there are a very small group of patients. So the surgical treatment of tennis elbow or golfer's elbow consists of recessing and releasing the air portion of diseased tendon, a frayed tendon, removing this, releasing it from the bone, whether it be at the medial epicondyle for golfer's elbow or at the lateral epicondyle for tennis elbow. There are more modern techniques to undertake the same operation using endoscopic techniques, arthroscopic techniques, whereas from inside the elbow, identifying these structures and cutting them. However, there are different methods of release with respect to how big the scar is. However, the principle is the same, and that is to remove and release the diseased portion of tendon from the bone. The vast majority of patients do get better with conservative treatment. The surgery is successful, however, this does have a couple of months before the patient fully recovers. Tennis elbow and golfer's elbow are both conditions where one has fraying and what's called tendinosis, where we have breakdown of the tendons. So on golfer's elbow, this is the tendon where the muscles which bend the wrist and flex the fingers, where these muscles are attached on the inside of the elbow, this tendon can break down and cause a great deal of pain because the tendon frays, and this is associated with repetitive activity and can be associated with golf less commonly. Tennis elbow is on the other side of the elbow, and this tendon attaches to all the muscles which extend the wrist and extend the fingers. And repetitive activity, classically this actually won't be a professional sports person. Classically this will be someone who's undertaken, they've been carrying boxes, lifting weights, doing some type of activity. It can be related to gym work, using very heavy weights, not enough repetition, so the muscle's not being worked on, the muscle and the stresses of the weight lifting is going all on the insertion of the tendon into the bone, and that certainly can be related to this.